They took a very healthy little boy and gave us back a very severely brain-injured little boy who was fighting for his life.
For Sue Stratman, her life changed in that instant forever. It was supposed to be routine hernia surgery for her son Daniel, who at 11 had conquered the odds after being born with congenital heart disease.
He loved soccer, and he ate, drank, breathed, slept soccer. Just before the hernia surgery, he made a select traveling team. He practiced one time with his team and never played soccer again.
So this family learned there is no such thing as routine surgery.
The machine itself wasn't monitoring Daniel's blood pressure because the cuff was never set. And so they told us he went 10 to 12 minutes without oxygen to his brain.
The medical mistake left Daniel with global brain damage and blindness.
We promised Daniel no tubes, and he came out of that room. We watched him as they wheeled him out of the OR, hooked up to everything. Nothing was working but his heart.
The patient safety movement has come a long way since the catastrophic mistake involving Daniel 14 years ago.
It is a cultural shift.
Today, medical consumers are being urged to speak up and ask questions about the care they are receiving from the start.
10 years ago, I could imagine going, why are you questioning me? I'm the doctor. That attitude's really just about gone.
The Missouri Center for Patient Safety and Missouri State Board of Nursing has developed this video with real-world information because you play a vital role on your healthcare team.
The intent of this center is really to learn as much as we can about what is happening with medical errors across the state of Missouri. The more we can learn about that, the more we know how to effect change to keep it from happening. Studies have shown that the more empowered patients are and the more active that they are as a member of their healthcare team, they actually do impact the quality and safety of care.
You may have seen signs like these in your doctor's office urging you to speak up, for good reason.
We had a sign in our office that said, "Don't be afraid to ask dumb questions." And if you don't understand what the doctor is saying, then you need to ask for more information, a different way to explain it. Have him draw a picture. You need to understand what he's telling you.
Dr. Michael Ditmore is a retired neurosurgeon. He encourages all medical professionals to take timeouts before any case. Here's why.
I didn't do an operation on the wrong side, but I was about to do it when a nurse said, "Stop. You want to think about this, Dr. Ditmore? Are you sure that that's where you want to do this?" And we stopped, we looked, and it was not. It had the potential of being an absolute disaster.
A surgical checklist promoted by the World Health Organization and Center for Patient Safety is being used in Missouri hospitals, assisting medical teams communicating at every critical step in the surgical process.
It's working its way into medical practice. It's something we learned from aviation and all the success that we had over the past 30 years in reducing aviation accidents has really been the introduction of checklists and making sure that no matter how senior you are, you go through this checklist because you may be in a hurry.
But despite safeguards, about 1.5 million medical errors happen each year.
There's always that aha moment or that downward spiral when you look at a case and say, oh, here's where it started, here's where the communication breakdown was.
Lori Scheid is the executive director of the Missouri Board of Nursing. Her office investigates about 1,100 care complaints per year.
Ask until you understand everything they're saying. And if they use medical terminology, tell them, I don't understand what that word means. You need to explain that to me. If you are not assertive in your healthcare needs or an assertive person, period, you need an advocate, and you need to have someone that you trust, that understands your values, what's important to you, and can help you make decisions.
An advocate should be with you when you are getting a serious diagnosis or test results, or if you just feel you need a second set of ears. For Lori, the issue of medical mistakes and patient safety is personal.
If it had been caught, then he would not have all that damage to his brain.
4 years ago, her husband Earl came down with a headache, backache, and fatigue. He went to the ER to be checked out.
Told him he had something viral. They weren't sure what it was, but they thought it would resolve itself and for him to just go home.
Turns out it was a serious misdiagnosis. 6 months later, the unthinkable happened.
My husband's taking a shower and I hear him fall, and I didn't hear him get up. So I went into the shower and opened the door, and he was having a full-blown seizure.
Again, the ER doctor tried to tell Lori her husband had an infection, but she demanded more answers.
And I said, "You've got to be kidding me. Do you see the same patient I see? He's sensitive to light. His head is killing him. He won't open his eyes. Something's horribly wrong with him." And he said, "No, it's just a sinus infection." And I said, "Well, I'm not going to accept that. I want to talk to who read his CAT scan."
Turns out Earl Scheit had an aneurysm, and it wasn't his first one.
My husband is not the same. He has brain damage. He's permanently disabled.
Studies show 70% of medical errors can be prevented. How can you ensure you get safe care? For one, make sure the doctor, nurse, or therapist washes his or her hands before they treat you. Don't worry, you will offend someone.
Without speaking up, you've lost a critical member of the team. That may be the only person who figured out that something was missing or something wasn't right. Or, you know, doctor, I didn't see you wash your hands when you came in the room.
It may seem simple, but 99,000 deaths are associated with infections each year. National patient safety movements point to reducing the rate of hospital-acquired infections to 0. You can make sure anything that touches or sits on the floor does not end up on your hospital bed. Write down any questions you have for your doctor prior to your appointment and be persistent.
And I'm going to ask questions until I understand, and I'm not going to leave a provider's office until I am sure that we have communicated.
The Missouri Center for Patient Safety promotes the national Ask Me 3 campaign.
What is my main problem? What do I need to do? And why is it important for me to do that?
The questions may seem simple, but knowing the answers can be life-saving.
If you have a planned surgery, you might want to ask how many of these procedures has your physician performed.
We need to ask questions. We need to know every aspect of the procedure.
When you're getting any kind of blood or a medication, you need to make sure that if you're in a hospital setting, that they're checking your identification band.
Medication errors alone result in 7,000 deaths annually, with many more injuries. A My Medication list can give your doctor vital information about any medication you are taking, including the herbal supplements and over-the-counter, to avoid drug interactions.
If you're a patient and you're getting a handwritten prescription from your physician and you can't read it, don't be afraid to ask them to write it again so you can read it, or ask them to call it into the pharmacy, because if you can't read it, there is a potential the pharmacy also will have difficulty reading that, and that could lead to a mistake.
Many providers are now, in fact, automating medication prescriptions to reduce errors. If you have a side effect of your prescribed medication, don't wait. Call your doctor or pharmacist. If you have a concern with the care you or a family member are receiving, don't delay in reporting.
Your healthcare professionals want to know about that, and they want to know about that as soon as possible. For example, if you're in the hospital, you can talk to your nurse.
The medical mistake is across the Stratmans bear each day. The family has started a patient safety foundation in Daniel's name to educate and inspire others with their story of courage. Today, doctors and hospitals talk openly about the issue.
There's a huge amount of transparency and openness that's finally dawning on this country. And it's a movement, I think, that can only help healthcare.
Today at 25, Daniel is attending college, but because he cannot see, he learns by listening.
And that is chapter 37, verses 36 through 38.
With his strong will and help of his parents, Daniel has a 3.96 GPA.
God has a plan for Daniel's life. And it must be better than anything we could have ever hoped for or dreamed of, because he's still here. And he's done far beyond anything anybody thought he would do.
1.5 million medication errors and as many as 98,000 deaths happen each year from medical mistakes. It only takes one to impact a family. When consumers step up and take charge of their health care, the prescription is change.
You are really in the seat to drive your health care. And the movement now in healthcare is to empower patients to speak up and actively engage as a member of your healthcare team.
You are part of the team. Take your role seriously.